guys, so chances are if you're listening to this video, then you are one of those people that have either been going to the gym regularly, you've potentially went to the gym regularly, but you're starting a newer routine or upping your current exercise regimen, or you're someone who's kind of like starting a New Year's resolution and you're hitting the gym hard with like heavier squats and lunges. But in either one of these three scenarios, you're starting to experience pain down in your personal and private areas, and you're wondering what the heck is going on. So in this video, we're gonna talk about why this is happening and kind of give you some idea of what is going to help to kind of overcome this condition and what's involved. So symptoms that a lot of people end up having when they start experiencing pain down in their private areas are anywhere from genital pain. In men, this can be scrotal pain, testicular pain, penile pain, sense of like heaviness in their rectum or in their kind of perineal region. And for women, it can be vaginal pain, burning, or vaginal heaviness, kind of like you have a golf ball stuck in that vaginal area. And additional symptoms that both men and women can have are things like rectal pain. And sometimes symptoms can start to morph over time if left untreated into things like bladder pain and frequency and bladder burning and retention, as well as lower abdominal pain. And so if you're experiencing these symptoms, I'm sure you're wondering, why is this happening? So we need to talk about basically a group of muscles and what tends to happen to them when you're starting to experience these symptoms. So we have to talk about a group of muscles called your pelvic floor muscles. Pelvic floor muscles basically have a housing inside of the pelvis. And so you can see here, this is a female model, but you can see shortly when I show you a photo that the female and the male model is actually not that different other than the genitalia. But with these muscles, you can see that they kind of line the inside of the pelvis. And from the outside underneath, you can see that they have connections to the tailbone, to the pubic bone, and to both sides of the sit bones. Now in a female, you can see, it has this connection all around and you have like the vaginal area right in the middle. And for a male, it's actually not that much different. So in a male, same idea as you have connections to the tailbone, to the pubic bone, and both sides of the sit bone. And you can see that the male genitalia is right in the middle as well. But as far as the inside of the pelvic floor, these muscles are the same pretty much in women and men. Now, this group of pelvic floor muscles is actually a group of 14 muscles, and each of them have different tasks, but they all do work together to support your internal pelvic organs, such as your bladder, your rectum, and for a female, their uterus. So these muscles play a huge role in sexual functioning, in your ability to pee, and your ability to have a bowel movement. So for many people, when these muscles start to get involved, this is why symptoms can start feeling like they're kind of urologic in nature or colorectal in nature, and sometimes orthopedic, because for a lot of people, they will actually start experience low back pain or hip pain or inner thigh pain or, anything even higher up into the upper abdomen as well, and even into the rib cage for some people. And the reason why this is important to point out is because these pelvic floor muscles, just like every other muscle in your body, they're all interconnected together. In fact, 2 of the pelvic floor muscles of the 14 muscles, they actually have attachments to the hip. And these pelvic floor muscles work with all the other muscles that connect from the diaphragm, which is your breathing muscle underneath your rib cage, all the way down into your hips. But you can take it further because it can actually affect all the way up into the head and neck and into the feet and vice versa. But for simplicity's sakes, we're just going to talk about the hip, the back, and the abdominal region and the pelvic region. So you can see here that you have a lot of muscles that connect on to this pelvis right in through here. Now, when I showed you this structure before, this is actually the pelvic model and the pelvic floor muscles are inside. But on the outside of this pelvis, this is where you have a ton of other muscles that I just showed you previously, and they all have attachments around that pelvis, okay? So you can see here that there are abdominal attachments, there are inner thigh attachments, gluteal attachments, and a whole bunch of other muscle attachments, even through the back. Now, your muscles in general in your body have 3 layers. You have a superficial layer, you have an intermediate layer, and you have a deeper layer. And so even if you peel off that top layer that I was showing you before, you have even deeper muscles within the abdomen, the abdominal cavity, and those leg muscles and thigh muscles that end up having connections to the pelvis. So inside of that pelvis is where the pelvic floor is. So if there are problems within that pelvic floor, then it actually can give you problems in other areas and other muscles that attach around that pelvis and around that hip. And again, vice versa. Now, if we look at the body from the back, you can also see here that there are a lot of attachments from the spine down into the pelvis. And again, there is your pelvic floor, and you can see these attachments into the hip. So a lot of people, again, that maybe have had a history of low back and hip pain might be vulnerable to these pelvic floor muscles becoming a problem. Now, the reason why this is also important is because all of these muscles, if it's pelvic floor or any of the other muscles that we just briefly went over, abdominal muscles, pelvic muscles, hip muscles, they will, when they are not balanced correctly and they're affected. And what I mean by affected is that these muscles become tight and restricted. And when they become tight and restricted, again, including these muscles of the pelvic floor, they can start to pull and tug on the structure of the body. So what ends up happening is you have all these imbalances around the hip and the pelvis, and then this will throw your function off. And so then when you go to the gym and you start doing your lunges and your squats or running or things like that, now you're kind of pulling and tugging on all these muscles, and they're trying to do the work that they need to do to kind of work out and do all of that stuff, but they're not doing it efficiently. And over time, that can end up being a problem. Now, what is the problem that's actually happening? So within these pelvic floor muscles, as well as the other muscles on the outside that we spoke about, when they become tight and restricted, potentially from overworking because they're not working efficiently, then they can basically form essentially spasms within these muscle groups. And these spasms, you can imagine that they're kind of like little balls of tight rubber bands. And I kind of say it's kind of the equivalent of a fist. If you have if you have this balled up rubber band, kind of like a fist, you're not getting good blood flow within that muscle spasm. And so those nerves that exist inside that band of muscles basically they're not happy anymore. And so if you don't have good blood flow through this area, if the nerves aren't happy, then they become painful. And so that area within that muscle can become painful, but not only that, they can actually spread symptoms all around in a variety of areas within the body. So, for an example, the pelvic floor muscles, when they have these tight bands of muscle, also known as trigger points, these trigger points can end up causing pain not only within the pelvis, but also in the genitalia in men. Again, it could be in the penile shaft, it can be in the tip of the penis, it could be in the scrotal area, the testicular area, and for women, it could be in that vaginal area, and then contribute to also the genital heaviness that you might be feeling. So this is a little bit about what is going on. It's essentially muscle spasms that are kind of being embedded in different places due to these imbalances, and going to the gym and maybe doing a little bit of a different workout or a heavier workout or doing too much of a certain type of squat or lunge activity tends to flare all of these things up. And so if you are having a lot of these symptoms, the likelihood that this is probably what's going on is the case. And especially if you've already been to a urologist, if you've already been to a colorectal doctor, if you've seen so many different doctors and you're just kind of getting the runaround and they're not really saying that there's anything specifically wrong with you, then this is likely what is going on. And how do I know this? I didn't even introduce myself, so I'm so sorry. My name's Hina. I'm a pelvic floor and orthopedic therapist in Philadelphia, Pennsylvania. And I have been treating pelvic pain in men and women for 25 years at this point, and our clinic here in Philadelphia and on the main line is geared towards treating a lot of chronic pain and especially pelvic pain conditions. So now what do we do about this? Because this is not something that, regular old stretches is just going to take care of. You really do have to learn how to release and improve the tensioning within these muscle groups. And the pelvic floor is just like any other muscle. If it's tight and it's restricted, it's gonna give you these symptoms. So what do you do with a tight and restricted muscle? If it was your hamstring, you would think, hey, I stretch it. Well, with the pelvic floor, you can't exactly go in and just stretch the pelvic floor easily. There are some stretches, of course, that you can do, but you can't easily go in and stretch muscles that are embedded in the pelvis. So there are a lot of different techniques that involve everything from breath work to actually getting onto those muscles physically and releasing them and getting that tension out of these muscles. But not only that, you also have to treat all the other muscles that are around the pelvis, the hip, the low back, and the abdomen to really get a nice balanced pelvis and to really reduce your pain. And so this is what we do here in our clinic every day in Philadelphia, is that we work on reducing a lot of these tensions and imbalances within these muscles. And once you do improve those imbalances, you should start to see that symptoms start to subside. Now, in some people, if symptoms really get out of hand, there does have to be some intervention, including sometimes medications and other interventions that can help just reduce any nerve irritation or really painful spots. And those we're not going to get into in this video because that's more of a medical intervention in nature. But sometimes those people need it that are really having like a whole blowout of symptoms. However, for most people, if symptoms are on like the mild to moderate side, or you're just starting to notice this, there is a whole bunch of things that you can actually do at home to really reduce a lot of these tensions. And making one single video for this is way too long, and it's not very comprehensive. So what we have actually done is, several years ago, we actually created, during COVID, for those who couldn't come to see us, we actually ended up making a whole program for people to be able to do at home. And it was such a huge success that we actually ended up modifying it and really tweaking it and making it so that anybody from home can actually start treating themselves immediately. If this is like something that you have been dealing with, and it's something that you're like, you know what, I just need immediate relief and I want to get started now because I'm not getting any other answers, then all of the information to actually download that program, and there's individual ones for both male and female, is right down in the information box. And the other nice thing is that if you feel that you are having a really unique situation, we actually do online consults and video consults. So if that's something that you are really wanting to talk to us about, then all of that information and the link is right below in the information box. And if this video was helpful to you, or you know someone that is suffering from this condition, then please subscribe and pass this video forward and share, and please comment and let us know if there's any other questions that we might be able to help answer for you, because every week we are trying to add new content to give you guys more information about these conditions. So I hope this was helpful to you. Have an awesome day.